Today, I want to talk to you about some helpful, free, and low cost health services that you may not know exist. So, first of all, you need to understand that this is a very big problem. If you're having a hard time affording healthcare in this country, you are not alone. 1 in 4 US adults has trouble paying for their healthcare right now. And around 80% of uninsured people were in families with incomes below 400% of the federal poverty level in 2022. This is a huge issue because healthcare is just so ridiculously expensive. So let's start off the list with some free clinics. It is possible for you to get the care you need without the cost in a lot of cases. Free clinics are able to help. They offer essential healthcare services for individuals and families who may not have insurance or the ability to pay for medical care. These clinics are often run by nonprofits, community organizations, government programs, and so on, and they provide a wide range of services. In a lot of cases, they even have pharmacies on site. Some of them do dental, some of them do mental health services. There's all sorts of help available here. And over the next few slides, I'm going to show you some ways that you can connect with some free clinics, hopefully close to you. So, first up, let's talk about federally qualified healthcare centers, or FQHCs. These provide affordable healthcare regardless of your ability to pay. They provide comprehensive care, including checkups, immunizations, chronic disease management, and more. Sometimes they even offer dental or mental health care. Sometimes they have pharmacies on site. Just depends on the specific center in your area and what they offer. Many of them will offer a sliding fee scale based on your income. So if you're not making enough money, you may not have to pay at all. If you're making a little bit more, you may contribute a very small amount depending on the amount of money that you're bringing in. You can find a federally qualified healthcare center near you at hrsa.gov. Now let's talk about NAFC, and I believe that's the National Association of Free Clinics, if I remember right. I meant to write that down. But the NAFC network includes thousands of clinics that are offering free or low-cost healthcare. Now let's talk about NAFC. I believe that stands for National Alliance of Free Clinics or National Association of Free Clinics. I meant to write that down. I apologize. The NAFC network includes thousands of clinics offering free or low-cost healthcare. Available services may include general health checkups, minor surgeries, labs, physical therapy, substance abuse care, medication assistance, social services, and more. You can visit nafcclinics.org to search for a clinic in your area. Now, you may also be able to get help from your local health department. The state and county health departments often provide free and low-cost health services, including immunizations, STD testing, family planning, prenatal care, and more. Programs are going to vary by state, so you'll have to check with your local health department's website for details, and you can just search your state plus health department to find services near you. Now, let's talk about Hill-Burton facilities. Since 1946, the Hill-Burton regulation has required certain healthcare facilities to provide free or reduced cost care to patients who can't afford to pay. There are about 140 healthcare facilities nationwide that are currently required to follow these guidelines. At least that was true at my last count. In order to be eligible, you must have an income that is no more than twice the current federal poverty guideline. If the facility is a nursing home, then you have to be under 3 times the federal poverty guideline. You must receive service, obviously, at the Hill-Burton obligated facility, even if you qualify for Hill-Burton coverage. If you go to a provider that isn't Hill-Burton obligated, that's not going to do you any good. You have to make sure that you're going to the right place. And of course, you must be found eligible to receive free or reduced cost care. If you'd like to see if there's a Hill-Burton facility in your area, you can visit the HRSA website for a full list. Please note that at my last check, there were no Hill-Burton obligated facilities in Alaska, Delaware, Indiana, Maryland, Minnesota, Nebraska, Nevada, North Dakota, Ohio, Rhode Island, South Dakota, Utah, Vermont, Wyoming, or any territory except Puerto Rico. But again, that was the last time I checked, so might have changed. There are some free clinics that are based on diagnoses. So the Black Lung Clinics exist to help treat coal miners with lung diseases caused by inhaling coal mine dust. These clinics serve active, inactive, retired, and disabled U.S. coal miners with all sorts of different services, including primary care, benefits counseling, pulmonary rehabilitation, and more. There are Black Lung clinics in 11 separate states, including Arizona, Colorado, Illinois, Kentucky, New Mexico, Ohio, Pennsylvania, Tennessee, Virginia, West Virginia, and Wyoming. And for people who need HIV treatment or support, the Ryan White Care Program is available to help. You can find a Ryan White Care Program provider near you by visiting findhivcare.hrsa.gov. Now, of course, if you don't want to have to track down a specific facility for your care, Medicaid is amazing if you qualify. Highly, highly recommend it. Medicaid covers low income adults, pregnant women, children, seniors, and individuals with disabilities. Eligibility is going to depend on your income, your household size, and what state you're in, because there are still some states that haven't fully expanded Medicaid, so sometimes the rules do vary between states. Now, if you are eligible, it may cover doctor visits, hospital stays, prescriptions, mental health care, and so much more. In some states, it'll also cover dental and vision care. Highly recommend Medicaid if you're eligible. You can apply online at medicaid.gov or through your state's Medicaid office. And if you do qualify and you do get Medicaid, make sure to stop by the other low income relief channel, our main one, and look for our video about Medicaid benefits, because there are some really crazy things that certain states are doing with their Medicaid money that can really help you. Some of them can help you pay your rent, all sorts of amazing things. But we already have a video about that on our main channel, so you'll need to go check that out. And of course, the CHIP program, that stands for Children's Health Insurance Program, that's going to provide healthcare coverage and, in most cases, dental services to children who qualify. It covers children up to age 19, so ages 18 and under, who do not have health insurance. This program is a lot like Medicaid, but it does vary state by state, and it's intended to cover children whose families make too much for Medicaid, but not enough to actually be able to afford that care on their own. So even if you have lost Medicaid for your family, you may be able to get CHIP for your kids, and I highly recommend looking into that. Now, just as a reminder, before we move on to prescription assistance and dental assistance and so on, I just want to remind you that hospitals in the United States have to provide emergency treatment to patients, whether or not they're injured. So if you are in an emergency situation, you can still go to the emergency room and get treated. This does include active labor as well. But you will be billed for that, obviously, because they can't bill your insurance. But if you are low income, many hospitals also offer charity care if you earn below 300 or 400% of the federal poverty level. That's 3 to 4 times the federal poverty level. So a lot of people qualify for that coverage, but hospitals are not very good at advertising that coverage. So that's definitely something you're going to need to look into and ask about if you think that you're eligible. So I just wanted to let you know about that. And with that, let's look at some ways that you can get help with your prescription medications. There are a ton of programs out there that help with prescriptions, okay? So first of all, there's patient assistance funds, and these are fabulous. These are special funds set aside to help patients with specific conditions afford the cost of their treatment. If you qualify for one of these funds, you can often get help with not only the cost of your medications or your health insurance premiums, you may also be able to get help with the cost of your travel and so on. You can find examples of these at tafcares.org, panfoundation.org, and so on. We have a list of patient assistance program resources on our website if you're curious about those. In addition to those, you should be looking at the manufacturer programs. Some prescription manufacturers offer significant discounts to low-income patients who don't have health insurance. So these programs can help you get your medications for free or very low cost. I know for a while I was taking a medication that cost over $10,000 a dose. Thankfully, my insurance covered it. But if my insurance didn't cover it, I was told that the manufacturer program would make that same medication only $25 a month, which is clearly an insane amount of money off of the regular price. So if you're in a situation where you're prescribed a medication that you can't afford, I always recommend that you contact the manufacturer, look into their assistance programs, and see what you can do to try to get help with those meds, because there's usually ways to get around the high prices that you may be quoted straight at the pharmacy. GoodRx is another example of this. That's a prescription discount card that you can take to the pharmacy that can drastically reduce the cost of your medications. I have seen some incredible savings through the GoodRx program, so I highly recommend that. It's free to sign up. It's not going to cost you anything, but it can make a huge difference in your ability to afford your medications. Now, if you need dental services, we all know that dental health is essential, but it's often expensive and it's often not covered by programs that are supposed to cover your healthcare, right? But there are programs that provide free or affordable dental services to those in need. So let's explore some options. First up, dental schools. Dental schools can be a great place to find cheap quality dental care. These teaching facilities have clinics that allow students to gain experience, and they do so by providing services at very reduced cost. Now, if that sounds scary to you, I get it. It was scary to me when I first thought about it. You need to know that the students at dental schools are closely supervised by experienced, licensed dentists who make sure that the work is done correctly. In fact, WebMD says that these appointments can take longer than usual because the licensed supervisors have to check the work at every stage to make sure that it was done right. But if you're willing to invest that little bit extra time, it's a great way to save money because they often charge half price or even less than half price for the services that they offer there. And of course, we already talked about things like federally qualified health centers and different community clinics, right? There are so many community clinics out there that offer free or low cost dental services. Sometimes those will be on a sliding scale, sometimes they'll be free. It's just really important that you know where to find those in your community. Community dental clinics can offer exams, cleanings, x-rays, root canals, fillings, crowns, tooth extractions, and more. The services that may be available to you may vary because not every clinic may be set up to do the exact same things, but it's worth looking into. And you can call 211 to find community dental clinics in your area. And of course, donated dental services are also great. There's about 15,000 volunteer dentists and dental labs across America that offer donated services. This is especially common for people who are elderly, disabled, or have chronic medical conditions. If you would like to get help connecting with donated dental services or getting help with those things, you can visit dentallifeline.org for more information. Now, of course, for more help, you can visit us at lowincomerelief.com, or you can check out our other videos for more ways to save money and get free stuff.